everyone, and welcome to Vivian Health's On the Horizon in Healthcare. My name is Dr. Beth Brooks, and I'm a clinical advisor here at Vivian Health. And today I want to talk about how we can enhance your recruitment efforts with having a really strong partnership between the chief financial officer and the chief nursing officer. And you might think, well, golly, how's that going to impact our recruitment? And I believe, and I'm sure many of you have experienced this, where nurse staffing, what's my schedule, what's the nurse to patient ratio, all of those kinds of questions are going to be top of mind for any candidate that's coming into your organization for an interview. So it's really important to have an understanding of sort of the, where behind the scenes, how is that nursing labor budget created? Because that is very important, because it's a huge part of the budget of any organization is the nursing labor budget. But also it's because it's such a big number and a large dollar amount, it's also an easy place for someone to think, oh, well, we can just cut this budget. And that's just not really what we're finding works anymore. So I want to talk today a little bit about a new report that's come out. It was a partnership created with the American Nurses Association, the American Organization for Nursing Leadership, and the Healthcare Financial Management Association. So here we have the nursing organization, the chief nursing executives, and the finance team members coming together to create some recommendations around best practices for a strong partnership between the chief nursing officer and the CFO. And so the report is actually called The Business of Caring, and it's about the CNO-CFO dyad, and how really important it is for that relationship to be collaborative versus the old-fashioned way, if you will, where it was less maybe perhaps understanding between two different disciplines, and how do we come to an agreement around what's best for patients, what's best for the organization, and what's best for nurses. So I want to talk a little bit about what the report sort of sets out as some of the baseline information. And once you have a chance to look through the report, it makes a lot of sense, because nurses always look at patient care from patient care and a quality perspective. We're always thinking about quality and safety and staffing ratios that are fair and equitable. And it's how we define value. Nurses define value as giving good patient care, whereas our colleagues in finance, they have a different mindset and a different way that they think about value. And so it's really important for those two partners, the nurse and the finance chief, to come together and sort of have a shared understanding of vocabulary and definition of terms and goals, and understanding the value each partner brings to the table when it comes time to doing nursing labor budgets. And for one example, I'll give you two examples. So when I say ratio to a nurse immediately thinks nurse to patient ratio. How many patients will be assigned to an RN? If you were to say ratio to a finance executive, ratio means a completely different thing to finance executives. They have various finance ratios that indicate different performance of the finance department. And so you can take a basic word such as ratio and understand that there could be a difference in understanding of what that term means. It's the same with a term that we hear often, non-productive time. To the finance team, non-productive time is time where an employee, nurses, are not productive in their job, which is to perhaps care for patients. But when you say a finance person wants to minimize that non-productive time. They're interested in every employee being as productive as possible while they're at work. You say non-productive time to a chief nurse, and that's a critically important time, because that's not only vacation and holiday and PTO, which is, we know nurses need to rest, to not be fatigued, to not have you know, stress and burnout. But non-productive time also includes all that staff development time, or going to a conference, or attending a workshop to increase your skills. And so it's not productive time in that you're not caring for a patient at that moment, but it's very important time that the nursing staff has time away from the patient bedside, to go to continuing education and further develop their skills. So here's two very simple terms: ratio and non-productive time, and even value. The finance folks will define value by dollars and cents, and nurses will define value as the quality of care. And so if we can come to some better understandings about what those words mean to each side of the table, so to speak, it helps to have everybody be on the same page about what the goal ultimately is, which is to have the best staffing to achieve the best patient outcomes at the right cost to the organization. And so we talk a little bit about the way the finance team builds the budget. They'll build the budget with the nursing executive team, but they're always looking at average daily census, and they're counting how many patients are in the bed at midnight. Well, we know very well that the number of beds on a unit has often no representation to the number of patients that may be on that unit in any particular shift. So using the census at midnight to count workload is probably not that accurate. In fact, we know it's not. Hours per patient day, that's another metric that's used by finance to look at how many hours of care are required. And again, the hours of care, those are the direct care time. So I'm the nurse, I'm physically touching that patient for so many hours for the day, but that hours per patient day doesn't take into account all of the thinking time that nurses are doing while they're preparing to go spend time with the patient. So those are two approaches to measuring the work that nurses do that really aren't accurate representations, but yet they are the metrics that finance uses. And so we have to be able to have those conversations about, what does that really mean? Census, we talk about churn and how many patients move through a unit on the day, on a shift. And then the hours per patient day don't really include the cognitive work that nurses do. So if you're sitting and talking with a patient or a family and doing discharge teaching, that's very working directly with the patient, but it's cognitive work. It's not tasks like changing an IV or administering a medication. And so it can be very challenging to quantify that amount of time that nurse is spending with the patient. So again, nurses, we look at value as achieving the desired patient outcome, preventing complications. We want to have be able to provide care ethically and in alignment with our professional standards, and having the time and the ability to do that to us is value. You talk to a finance person and they want to know, what's the return on investment? How efficiently have we moved patients through the OR, or how efficiently have patients moved through the emergency department? Those are very important metrics, and finance is interested in HCAHPS, which are the quality metrics from the CMS. But those metrics are made up of other components of care that are just as important as the physical touching and tasks of care. So we have to kind of come to a place where the finance folks understand what we mean nurses by value, and we nurses need to understand what they're looking for when they're working on budgets and what's value to them. So it's just one of those relationships. I always say nurse executives and nurse leaders have to be multilingual. You have to be able to speak the terminology and understand the language of nurses and nursing care and quality and value, but then you have to put your finance hat on and be able to talk to the finance team in their terms and what's important to them and what their ratios are. And so the when these three groups came together, that was one of the biggest aha moments was, oh, we're both talking to each other in different languages and we don't necessarily understand. And therefore that inhibits collaboration. And so this old approach to creating a nursing budget was very finance driven, probably only looked at the cost side of the equation. What is this costing me? How many nurses, how many FTEs? And the finance team in the old days probably didn't link those costs to the outcomes that were being achieved. Was the patient not being readmitted? Was the patient not falling? Those are all very important outcomes that we measure now because we know that those are the type of outcomes that increase the cost of care, those negative outcomes. So the more we've learned that it's best to collaborate between finance and nursing, having shared metrics, having shared definitions, using current research findings. Nursing has their research body of evidence out here. Finance is probably not reading the nursing research, just like nursing is not reading finance research. So bringing those research findings around best practices around staffing and patient outcomes and cost and quality, bringing all those to the table together educates both partners, the finance team and the nursing team, on what's important. And one of the tricky areas still is demonstrating that the cost of care, cost-effective care, and quality, and cost effectiveness and quality. We're still trying to, is some more current research that shows high quality care is cost effective care, but that sometimes can be a challenging argument or a challenging case to present because that data and that research is still coming in. But nurses intuitively know that if you provide high quality care, you're going to have, it will be cost-effective care. It's when care is of less quality that it's not effective. And that's where the care starts to become more costly. So I hope that makes sense. The tighter relationship we have between our finance colleagues and our nursing colleagues, and this common language and common metrics and common definitions will allow those two people to collaborate. And in many respects, it's treating each other's knowledge and expertise. A finance person has no knowledge, frankly, about how to staff a nursing unit or what's the proper care delivery model or how many FTEs of different kinds of people are required. That's really not finance's expertise, nor is it their role necessarily to dictate that. What finance can say is, here is the budget for nursing. Here's the dollar amount. You, chief nurse, determine how best to deploy those dollars, what the skill mix is, what the staffing is, what the ratios are. So to try to, balance nursing's expertise is deploying those people and determining which people are appropriate, whereas finance role is determining this is what we can afford, or this is what the budget will allow for the nurse staffing budget. So having that more collaborative approach is beneficial for patients. It's certainly beneficial for nurses, and it just creates greater awareness between the finance team and the nursing team, and that everybody is on the same page. They just look at the situation a little differently, so to appreciate each other's perspective. So I hope that makes sense for our folks in human resources, understanding a little more about how finance and nursing collaborate on the budget. And then our chief nurses, what kind of relationship? Do you have a collaborative relationship with your finance team? And for our folks in finance, the same. Are you learning to understand and use the language and understand the definitions that nursing uses so that we can collaborate together on the best financial resources for patient care? So the report is available. It's very easy to find. You can find it on any one of those websites, American Nurses Association, Healthcare Financial Management Association, or the American Organization for Nursing Leadership. So if you have any questions, specific questions about building that team, I would refer you to the report. And I want to thank you for joining us today. And if you have any questions or want more information, please just let us know, and you can reach us and visit us at hire.vivian.com. Thank you.